Thank you, Lindsay, and greetings, everyone. It is a real thrill to be here in my hometown on the traditional unceded territory of the Lekwungen-speaking people, the Esquimalt and Songhees First Nation. Joining us today as hosts, of course, is Rob Thomas, the Chief of the Esquimalt Nation, and Ron Sam, the Chief of the Songhees Nation. We're also joined here at the podium by 4 national Indigenous organization leaders who the premiers have invited to have a kickoff to the COF 2022 discussions around the importance of reconciliation, the importance of addressing land claims, and the importance of addressing issues of murdered and missing women, obviously looking, of course, also at the challenges that have emerged, generational trauma as a result of residential schools. So with us are Regional Chief Terry Teegee from the Assembly of First Nations here in British Columbia, the Métis National Council President Cassidy Caron, the Congress of Aboriginal Peoples, Elmer St. Pierre, and of course from the Native Women's Association of Canada, Lisa Weber. And all of us today have been discussing the range of issues that I touched upon. We wanted to talk about, of course, the challenges of dealing with the Indian Act, archaic legislation that was brought in at a time when the residential school policies were being developed and implemented across Canada. Clearly, in 2022, with the revelation of 215 unmarked graves on Tk'emlúps and Secwépemc territory, as well as revelations from residential school territories around Canada, it's high time that the national governments, provincial governments, and Indigenous peoples work together to heal that trauma, turn the page, a black page on our national history, and start anew with a dialogue about how we can all live in harmony on this land that has been populated by Indigenous peoples since time immemorial. Firstly, we talked about the UN Declaration on the Rights of Indigenous Peoples, which is an act that was embraced, or a UN proposal that was embraced by the province of British Columbia, working with Chief Teegee and other members of the First Nations Leadership Council here in British Columbia. We are now 4 years into the Declaration Act, as well as just this past spring announcing our work plan going forward to 87 items, Terry? 89? 2 more were added while we were in the room. 89 action items within the work plan. And what I wanted my fellow premiers to hear, not just from Terry and not just from the other Indigenous leaders here, but our hosts, Chief Sam and Chief Thomas, that when we passed the Declaration Act, the sun came up the next day. When we passed the Declaration Act, the only thing that changed in British Columbia was that justice arrived for First Peoples, whose lands have been used by settlers who have come over many decades, centuries in fact. My father, an Irish immigrant, I myself am a result of European expansion, but I am proud and pleased to be here with my brothers and sisters from the Indigenous community to talk about real reconciliation, and it starts with leadership at the provincial tables, working with the federal government, and then, of course, most importantly, working with Indigenous communities. We touched on a bunch of critically important issues. Child welfare, again, harkens back to the residential school processes, the 60s scoop. We now have in British Columbia and in other jurisdictions a move, and the federal government has been leading on this as well, a move towards children being kept in community, being kept in their cultures, and so that the trauma of family disruption and disunity does not also lead to a loss of culture, a loss of person, a loss of who you are and where you fit in the cosmos. These are critically important issues, and we had an opportunity today to sit down around a table, the first time since the pandemic, where we could be face-to-face talking candidly about the challenges Indigenous people are facing in every corner of the country, having First Ministers here to hear those stories, to also engage in dialogue, I think was very useful. And I'm just proud and honored to share this podium today with my colleagues to let you know that COF 2022 is underway. After this press conference, I'll be returning to the conference center, and we'll be picking up the primary issue that we came together to discuss, which is the state of public health care in Canada. But public health care affects us all. It certainly affects Indigenous peoples as well. And so we touched upon that in our remarks this morning. So with that, I think I'll open up the floor, and any questions directed either to our hosts or to the heads of national Indigenous organizations. Certainly I'll be ceding the microphone, but I'll do my best to get us through this to meet your requirements, and we'll go from there.
I would also ask that you please keep the questions on topic. Rob Shaw, Check News.
Okay, I will split this question in half then, Premier. I'd be interested in hearing from any of the Indigenous leaders about the value of the meetings with the premiers and the Premier today and what that accomplishes. And then after that, back to you, Premier, on healthcare transfers. Do you intend to come out of this meeting with a very specific way that you would spend the money if you got it from Ottawa on particular items to prove that it's not just being absorbed into an already stressed system? So those are the two.
Well, why don't I open it up to my colleagues to respond to the first piece, starting with Terry, and then I'll come back to the healthcare piece.
Thank you, Premier Horgan. I think the story here in British Columbia as we implement Bill C-41, the United Nations Declaration of Rights of Indigenous People, as a provincial act, I think what could be learned here can be replicated elsewhere. And more importantly, that as we implement it and pass UNDRIP as law, that the sun came up the next day. That free, prior, informed consent isn't a veto. Rather, it's a space that all governments can come together and make decisions, such as the Tahltan with Section 7 agreements. And I think it's really important to really assert back to provincial governments and nationally to the Prime Minister is that what the United Nations Declaration means to Indigenous peoples is the assertion of their sovereignty and self-determination. And I think that's an important lesson that we could share from the British Columbia experience between myself and Premier in terms of why it's so important such things as UNDRIP can be utilized on all levels of government, municipal, provincial, and federal. Thank you.
Next question. Oh, go ahead, sorry. Sure.
So these meetings of premiers all across this country are extremely valuable. We spent the morning getting to know one another, getting to build the relationships, talk about the issues that are important to our people, the Métis National Council, the Métis Nation, knowing that these issues are critically important to each of the provinces and territories across this country as well. And there's solutions that we can all develop together through talking about, our challenges, talking about best practices, what's working and what isn't working in each of our jurisdictions, and how can we work together to create solutions that will actually create change and implement change for all Canadians and build a brighter future for Canada. So the importance of bringing us all together to meet with the premiers across this country is critically important, and there needs to be more opportunities in the future to continue these conversations.
Thank you. I'll just share on behalf of the Native Women's Association of Canada. The message that was clear to me from this morning's engagement was that there is commitment to inclusion, commitment to continuing to achieve measurable outcomes for Indigenous women, children, and families across this country. And so I'm coming away from this meeting feeling very positive and hoping that there is that continued commitment for including us at these tables. Thank you.
Elmer St. Pierre of the Congress of Aboriginal People. Today's meeting was very successful. I believe that we're going to be able to we left the tables and with good partners that want to work together. And like the Premier said, there's a lot of work ahead of us, and we have to work together to make this happen. And like I said, it was a really good meeting. Thank you.
Thank you, colleagues. And with respect, Rob, to your question about detailed proposals from the province to the federal government, well, we've done that, and we're waiting for a response. I did engage with the Intergovernmental Relations Minister over the weekend, and I got a text from the Prime Minister this morning. They're aware. They've been working on it, but we can't determine what we're going to do with money we don't have. We're working on building out our budgets right across the country to meet the expectations of patients, to meet the expectations of our citizens. And we can go a lot further if we had a partner that was carrying half the load. That has been the history of the Canada Health Transfer. That's been the history of Medicare in Canada. It has been a dual responsibility, with the provinces delivering the services and the federal government assisting in the funding of those services. That has diminished over decades. This is not at the feet of the current Trudeau administration. This has been happening back to the 1990s, and in fact, even you could argue Some have, going back to the 1980s. So this is not something that we take lightly. It's not something that we're looking at as a temporary measure. We need to reimagine public health care in Canada. We need to make sure that the funding will be there. And the investments that we can make in people, ensuring that we have a human resource strategy that allows us to not poach from each other, but to make sure that in all of our jurisdictions, we're training the next generation of healthcare workers to take the burden off those who we celebrated during the pandemic with banging of pots and making noise at 7 o'clock every night. Well, it's just not good enough to show our gratitude. We need to now show that we're committed to those workers, we're committed to those patients, and that's what these discussions are about this afternoon and into tomorrow.
Next question, Katie DeRosa, Vancouver Sun.
Chief St. Pierre, your Congress mentioned this morning that the majority of Indigenous First Nations people are living off reserve in urban communities and raise the lack of services in those areas. The federal government in the election had promised $4.5 billion for the provinces and territories for mental health funding. So for both the Chief and the Premier, how important is that funding to providing those services to Indigenous communities and to anyone who needs those mental health services?
Well, I would take a different approach to answering the question, Katie, because what the problem has become in Canada is successive federal governments have said, here's a pot of temporary one-time funding to address the immediate need that's apparent in communities across the country, whether they be Indigenous or not Indigenous. And that's not working, because once those temporary, part-time, once-only funding pots empty, we have a void, which then is inevitably filled by the jurisdictions that are providing the services. Once the public has access to those revenues to build out programs, we want those programs to continue. We need sustainable, long-term funding to make that happen. Grateful for all of the work we did together, all of us, not just the people in front of you, but premiers and the federal government throughout the pandemic. We met 36 times as premiers and prime minister to deal with the issues as they were emerging. And there was significant investments of one-time money to get us all through the pandemic. We're through the pandemic now. The federal government committed to sitting down with us at a table to hash this out. And we've been exchanging briefs, we've been exchanging phone calls. We haven't been sitting in a room addressing the root problem, and that is long-term sustainable funding. So is $4.5 billion over 36 million people, over the second largest landmass on the planet for a short period of time, welcome? Of course it is. But it's not going to solve the problems.
Yeah, like the Premier said, it's not the province's fault. They get X number of dollars, that's all they can do. If it means they can only service, 3,000 people within the province, that's it. The federal government has to step up. It's been like that for years, and every province, and including our national Aboriginal organizations, we all need help. And the only way we're going to get help is through the federal government, and they got to sit down with the premiers and make a solid plan. And like the Premier said, $20 billion, whatever the case may be, for just a fixed income or fixed project, that's kind of like putting a Band-Aid on something. Then they think it's going to go away. Well, it's not going to go away. It's been here for years, and it's going to continue on. Thank you.
If you want to step up to the mic, please identify yourself.
Hi, Andrea Wu from the Globe and Mail. As provinces push for more funding from the federal government, there are groups that say provinces should and could be doing more. So here in British Columbia, for example, in primary care, the issue with retaining family doctors, we know that the fee-for-service model is problematic. And yet, BC has among the lowest rate of doctors being paid through alternative payment models. So why not increase that, or add a fee code for time-based billing as we did for Paxlovid, for example?
Well, thank you for that. And I absolutely agree. The fee-for-service model is not meeting the needs of patients. It's not meeting the needs of general practitioners. But you provided evidence to why the salary model isn't working. Doctors aren't signing up for it. And there's a whole bunch of variables there. I've sat down with the doctors of BC, with the Deputy Minister of Health and my my Minister of Health, Adrian Dix, and we're on a track. Discussions are underway to find a way forward on that challenge of how do we fix the system so that we can have a patient-centered model, not a physician-centered model. And most physicians are absolutely delighted with that. They don't want to come out of med school and then inherit a business with overhead that they can't control when they just want to practice medicine. So you see younger doctors signing on for salaried positions focused on delivering the care that they trained for, that they're passionate about. But we also have long-term GPs who have significant investments in infrastructure that are problematic as we move from one system to another. So it needs to be gradual, it needs to be negotiated, and I'm confident we're on the right track. But we also have a recruitment challenge. It's not just retention, it's recruitment. Today we had the opportunity, we started 7 o'clock breakfast with the nurses unions from across the country. The national president convened the meeting. We had the head of the BC Medical Association, or the Canadian Medical Association there as well. And it was, what excited me was we had premiers and union leaders sitting at a table, not negotiating, not talking about contracts, but talking about the challenges. And that, I think, is the first order of business. That's why it's so critical to not exchange briefs in a transactional way, but to sit down and say to the federal government, to the Prime Minister and his team, we have a problem here and it's not getting better. If you don't like our solution, what's yours? And that dialogue has been stagnant for the past 7 months. I had a commitment from the Prime Minister back in November that we would work on this, and he put together a team, and we had our team, included Premier Andrew Furey, who's a surgeon, who's a Liberal, not that that matters, Premier Scott Moe, the former chair of COF, who's conservative-leaning, not that that matters, and me, the lefty, not that that matters. We're 3 premiers that have the same problems wherever we live, whatever our political perspective is. And that's the value, as my colleague said, of coming together face to face. Is the partisanship doesn't exist. It's people talking about other people. And that's what's been missing from this debate. And going back to Rob's first question, how are you going to divvy up the pie? Well, we need to know what the pie looks like before we start having a discussion. We have primary care issues in British Columbia, long-term care issues in Quebec. In Alberta, with a younger population, they have different issues. But all of us have challenges when it comes to healthcare. And I have a challenge with saliva, so apologize. Oh, sorry.
If I may just chime in on that particular issue. I think about the fact that we have, it's been a number of years since we had the report released by the National Inquiry, and part of that report said clearly you need to include Indigenous people in the solutions. And so if there's a problem with the conventional model, how about looking at revamping that model, completely turning it on its head and saying, let's include Indigenous people in those solutions. We have significant problems across this country. Opioids, mental health, not only related to the COVID-19 situation that we all are impacted by. We have the re-traumatization of Indigenous peoples across the country with this really awful situation of the discovery or dealing with unmarked graves. And so I really encourage the premiers and the Prime Minister to consider including Indigenous people, experts, as you reconsider what model works for all Canadians, including Indigenous people.
We have time for one more question. Just a reminder, there will be a 2:45 press conference at the Empress later today. Go ahead, Binder Sajan, CTV.
So, Premier, getting the money is one thing, and getting the staff to actually fill positions that are needed in healthcare is another. So, even if the money were to come, how long would it take, and how would you ensure that other provinces simply wouldn't pay more and be in that race to get the same resources in terms of people?
Good question, and the notion of poaching is part and parcel of what we were discussing, will be discussing today. We have a national challenge when it comes to recruiting and retaining skilled healthcare workers, whether it's nurse practitioners, doctors, surgeons, general practitioners, care aides, you name it. We're short all the way through. You talk to any business operator right now, their number one issue, normally it would be taxes, taxes, taxes. It's not. It's people, people, people. We don't have enough people to fill the vacancies in our private sector economy and in our public sector economy, which, of course, the most important public service we provide is healthcare. So we've been increasing spaces in our post-secondary institutions. Other jurisdictions have been doing that as well. We need to ensure that foreign credentials are recognized much more rapidly than they have been to this point in time. That's been, quite frankly, a more difficult process than I think most Canadians would realize. If I was to sit down at a kitchen table and talk about the challenges of having foreign credentials, health credentials, recognized in British Columbia or in Alberta or in Manitoba, people will be horrified. Why is it taking so long? It takes so long because there are a whole host of systems that are in place that are no longer functioning at maximum capacity for the agencies that they're designed for, whether they be doctors, nurses, care aides, and so on. And similarly, we have challenges about what is the model? Is it fee-for-service? Is it salary only? How do we manage shortfalls? I tell a story of my time after surgery. I was in post-op, and a nurse who was in the first trimester of a pregnancy was fantastic care, as I would have expected, compassionate, kind, professional. And I said, I guess I won't see you. I'm hopefully checking out tomorrow. And she said, no, you'll see me because I have to stay at my replacement called in sick. So the strain on the faces of healthcare providers is not about accounting. It's not about the Canada Health Transfer. It's about people who are strained beyond belief. And the nurses across the country talked about that this morning. And doctors feel the same way. Surgeons feel the same way. Care aides, nurse practitioners, social workers, everyone is feeling the strain. We need to make sure we're training the next generation of welders, of carpenters, but we also need to train the next generation of healthcare providers. And we're taking steps in that direction. Our budgets reflect that across the country. But this will not be solved by the waving of a wand. It'll be solved by hard work and relationship building, as you've heard from my colleagues. That's how you make progress. And again, a fantastic example is to sit down with nurses union representatives from across the country, and we didn't talk about benefits, we didn't talk about wages, we talked about people and how important it is to make sure that we're building out a human resource strategy that meets the needs of a modern, dynamic country like Canada, which has been so blessed with public health care. And it takes 5 minutes to scan the media in the United States about how they stumbled through COVID, how they're stumbling through basic delivery of services because they don't have a publicly funded, universally accessible program. We do, and we need to work hard to protect it.
We're going to squeeze in one more question. Brenna Owen, CP.
I really appreciate that. Thank you. So the federal government promised an additional $2 billion back in March to help clear some of the surgical and other backlogs. But my understanding is that the money hasn't been distributed to the provinces yet, and I'm just wondering how that's affecting BC's system and what you've heard from your counterparts.
Well, we did a lot at the front end of our mandate to reduce surgery wait times by bringing on new surgery, filling up our surgery capacity. We had surgery rooms or operating rooms left vacant because we didn't have the staff to fill it. So we started bringing on more staff. We started doing procedures in the wee hours of the morning, which was great for patients, particularly in our urban centers. It's easier to get to St. Paul's Hospital or to Royal Columbian at 3 in the morning than it is at 3 in the afternoon. So we were able to go through a great deal of the surgery backlog, and then COVID hit. And for reasons you're all aware, we had to pull back on surgeries, which saw the list going up again. I can't tell you where the funds that have been committed are in the system, but I can tell you that they won't be adequate to meet the long-term challenges. What we need is a commitment of $2 billion and then $2 billion and then $2 billion on through time, not here's some money for now, best of luck, because it's not getting better, it's getting worse. And although the Band-Aid is welcomed, we need stitches and we need prosthetics and we need a whole bunch of other equipment and people to make it all work. And until such time as the federal government does more than say they're listening, we're going to be having this conversation. I've been 5 years at the Council of the Federation. This was the #1 issue when I stepped up to the table, and it's the #1 issue as I'm walking away from it. That tells me that half a decade, and of course, time goes a lot faster in a social media environment, so the criticisms are coming thick and fast, and that's fine, but the solutions have to be coming at the same pace, or we're just going to be in a sea of unhappiness. We don't deserve that as people, because of all of the investments and the sacrifices Canadians have made for generations to build this system to what it is, We need the next generation to take it the next mile, and I'm confident we can do that, but we need a partner.
That's all the time we have. We look forward to seeing
Thanks,
you this
everybody.
afternoon. Thank you.